Good morning, everyone, and happy Friday. We're so glad everybody could join us, especially towards the end of the year and it's festive season. So we're very happy to see so many faces. We will begin the meeting now, and I'll hand over to ASG Konings, and then Dave will take it forward from there. ASG Konings, please, the floor is yours.
Thanks so much, Farah, and all of the colleagues, and a good day to all of you here present. It's really a great pleasure to welcome you all to today's event, and I particularly want to welcome our guest speakers from the Global Research Network, which I think is really a unique partnership that continues to provide CTED with access to the latest research on key terrorism and counterterrorism trends and challenges. So most grateful to all of you. And it's almost 2 years since the beginning of the COVID-19 pandemic, and since June 2020, CTED's analytical paper series has provided policymakers with important insights into key short, medium and long-term impacts of COVID-19 pandemic on terrorism, counterterrorism and CVE. And our analysis has been based on CTED's engagement with all of its partners, ranging from the member states, civil society actors, the researchers, international and regional organizations across the globe. We have published so far 3 papers on this vital topic over the past 18 months. And as you all know, our 4th and final paper in the series saw the daylight early this morning, 7 a.m. New York time. And this latest report provides a concise overview of how the COVID-19 pandemic has impacted terrorism, the way we counter terrorism and counter violent extremists so far. And it points to some of the future challenges that I'm sure we will hear about this morning. Allow me to reflect on some of those observations. Firstly, terrorist groups have sought to exploit pandemic-related socio-economic grievances and political tensions, which have often been exacerbated by COVID-19 related restrictions, and to expand their influence, drive their recruitment efforts and undermine state authority. And secondly, in conflict zones where the threat of terrorism is predominant, the pandemic appears to have a limited impact on terrorism activity. Pre-existing trends of violence conducted by ISIL and Al-Qaeda affiliates have largely continued. However, in non-conflict zones, travel and social restrictions have made it difficult for terrorists to plan, conduct operational activities, and thereby undermining their ability to carry out attacks. Finally, it's clear that responses to the pandemic have impacted counterterrorism and CVE efforts. Lockdowns and social restrictions imposed to limit transmission of the virus also closed or limited civic spaces. And this has made it difficult for CSOs and other non-state CVE actors to conduct programmatic interventions in communities vulnerable to radicalization, to violence. There have been also examples of states using pandemic-related restrictions to curb dissent and target groups raising legitimate concerns, including civil society actors, human rights defenders, and journalists. The proliferation of emergency measures and the curtailing of civil liberties has raised serious concerns about government overreach, and which we know has the potential to exacerbate existing grievances. And of course, we also know that this type of situation can be ripe for exploitation by terrorists and violent extremists. Dear colleagues, ladies and gentlemen, while the paper series has reflected on the contemporary impacts of the pandemic on issues related to terrorism and counterterrorism, I will listen to today's discussion with great interest as we try to place potential longer-term impacts into a post-pandemic future. We already faced a complex terrorism landscape prior to the pandemic, And we're also reflecting on the 20th anniversary, the 9/11 terrorist attacks and the subsequent adoption of Security Council Resolution 1373. And in this context, today's discussion offers a vital inflection point to reflect on what new challenges we will face in terrorism, counterterrorism, and CVE in the coming years. What will be the terrorist ecosystem and how will that influence member states and civil society abilities to address the constantly evolving threat? And what lessons can we learn from the past 20 years that can inform these responses? What remains clear is that these efforts must include robust cooperation at all levels, and I always mention the same levels: local, national, regional, and international levels. And this cooperation should also include close and frequent engagement with a broad range of partners, including women, academia, civil society, and the private sector. We must focus on the development of evidence-based policies that can ensure both counterterrorism progress and an inclusive recovery from the pandemic that leaves no one behind. Before ending, I would just like to really heartfully thank all contributors to this event, to the paper. Behind the scenes, a lot of people at CTED have been active, and I think it's always extremely important to thank everybody without naming any person in particular, which I never do, but to all of you at CTED that have been instrumental and heartful. Thank you. And I look forward to today's discussion. Thank you, and over to you.
Thanks, Michelle. So yeah, we're now just going to quickly try and play the video that we launched this morning alongside the paper. I believe if you're logged in on your mobile, you might have some issues with the sound, but we'll share the video in the chat afterwards. But if you can just bear with me, and fingers crossed, everything works technologically.
Stringent border control measures and restrictions have curtailed terrorist movements and activities, reducing the number of terror attacks carried out in non-conflict areas. In conflict-affected states, pre-existing trends of significant terrorist violence have continued.
So all the trends that we saw happening before, they've been supercharged, as everything else seems to have been by COVID.
They have consolidated their positions with alienated and marginalized communities and are exploiting crises such as the COVID pandemic to win the hearts and minds of populations by providing basic services to communities, filling the humanitarian vacuum left by the humanitarian actors on the ground.
We've witnessed this quite heavily in western and southern regions of Africa. So we've seen that 7 of the most affected countries of terrorism in 2020 were actually in Africa.
The COVID-19 pandemic has created exceptional conditions for online radicalization and extremist recruitment and has seen a rise in anti-Asian hate and anti-Semitic conspiracy theories.
This global shift online has also impacted financial behaviors, as reflected in the increased use of remote transactions that make it difficult for financial institutions to conduct customers' due diligence and detect potential financial anomalies.
I think we need to be quite open-eyed about the abuse and the misapplication of counterterrorism measures by state actors, the impact that it has on citizens, on civil society, as well as the many human rights violations that are going to continue to be critical as we analyze how radicalization and recruitment are developing.
CTED's analyses also note the gendered impact of the pandemic, which threatened the hard-won progress of previous years. Globally, women are facing a greater care burden and greater economic insecurity. Violence against women has also increased at an alarming rate during the pandemic, both online and offline. COVID-19 has forced many states to delay hearings or extend proceedings, prolonged pre-trial detention, and caused case backlogs. And this has also prevented the victims of terrorism from gaining access to proceedings.
If we're looking at CVE and preventing violent extremism, I think the fact is that states need to be much more honest about their own willingness to understand and address underlying factors, whether they are push factors, pushing people towards extremist activity and ideology, or pull factors gaining, so that are attracting people towards a larger cause.
COVID-19 and terrorism are, of course, both transnational issues, and both must, of course, be addressed through global cooperation. As the full impacts of the pandemic on terrorism and counter-terrorism continue to emerge, it is vital that we continue to hear perspectives from civil society and the research community, including the members of CTED's Global Research Network.
Okay, hopefully that worked for everyone. Without further ado, I'll hand over to my colleague, Anna Schuber.
Thank you, Dave. Good morning, everyone. And before I begin, I would like to thank ASG Connings for her very comprehensive introductory remarks. So today we are here to discuss the post-COVID landscape and the potential terrorism and counterterrorism challenges in that. Of course, recognizing that COVID is not over and the situation is evolving and very fluid. As ASG Connings mentioned, today morning, we published our fourth and final report in the analytical series on this issue. And CTED has been at the forefront of monitoring and analyzing the impacts of the pandemic on global terrorism from the very beginning. So in our last report, we had seen that more than 2/3 of our respondents had stated that COVID-19 has made counterterrorism and CVE much more challenging. As ASG Connings mentioned, and from the video you saw, CTED has been engaging with our partners, including members of the global research community on this issue. And we had benefited from the expertise, not just in-house from our colleagues, but also from our various partners, including member states and various CSOs. So, of course, the pandemic has exacerbated many pre-existing issues and challenges that shapes the terrorist landscape. And we have witnessed that many geographical regions and also thematic areas have witnessed a continuation of existing trends. When it comes to the long-term impacts, in order to comprehensively conclude the impacts of the pandemic on terrorism, we still need data. We require more research as we analyze and study the situation. We see economic downturns, redirection of counterterrorism resources, especially impacting fragile states that are facing threats from terrorism. We find reduced trust in governments, a lot of fatigue in civilian population with the restrictions, which create conditions where terrorists and their affiliates might exploit this kind of existing grievances to disseminate their propaganda. Also, there has been increasing humanitarian needs, which has created dire conditions in many areas. We are also witnessing unequal distribution and lack of access to vaccinations, which is a huge challenge and can be potentially a condition where marginalized communities especially would be taken advantage of by these groups. So just to understand a couple of these issues and try to gauge what might be one of the key challenge and also few existing concerns that the counterterrorism community would face moving forward, we have called upon three key experts today. We have a great panel. Before I introduce the panelists, I would like to mention that our fourth panelist, Ms. Zenaida Machado from Human Rights Watch, is not here yet. We are hopeful that she would be able to join. Having said that, I would like to introduce the rest of the panelists. First, we have Ms. Rasha Al-Akidi, Rasha is a senior analyst and the head of the Non-State Actors Program in the Human Security Unit at the New Lines Institute. Prior to joining the New Lines Institute, Rasha was the editor in charge of Irfa Satak, a US-based platform that offers insights into post-conflict communities in Iraq and Syria through personal digital storytelling, essays, and photo collections. I have asked each panelist to kindly limit their initial intervention between 3 to 5 minutes, and they are going to frame their responses on 2 questions. The first is, what are a few initial long-term impacts of the pandemic in their area of expertise, and what are some of the likely challenges to evolve in the near future? Having said that, I would hand over the floor to Rasha, please. Thank you.
Thank you so much for the introduction. Thank you for inviting me to this important panel, and very timely, as we talked about earlier, as the pandemic seems to be stuck with us for the time being. So some of the challenges that are very unique to this particular pandemic is that when it relates to terrorism and also to the types of future terrorism that we might be facing, and that the CVE community is perhaps at this point not prepared to handle or face, just because the type of threat is new. When we think of terrorism, we do think of armed groups. We have a picture in our head because we've been dealing with these groups for the last 2 or 3 decades. We have Al-Qaeda, we have ISIS, we have different groups that are similar and have for the past decade or so, they have acted in a way that has become quite predictable. We're familiar with them. But what COVID and what the restrictions and everything related to it has produced a new type of thought, a new type of radicalism that approaches now extremism level. It's almost created some kind of cult that can, in the future, end up resulting in some sort of violence. Now, we've seen some kind of sporadic violence, even in Europe, and this is where the danger lies in. It's not in a part of the world that we can consider far from us. The threat is kind of at home at this moment. So we've seen in Denmark, we've seen in the Netherlands, even in places that even Finland, attacks against facilities and certain institutions that was not very common. Now, so far, as mentioned in the video, a lot of it has been online radicalization, and it comes from distrust in governments. It comes from a lot of conspiracy theories. And those of us who have studied CVE and been part of this for a while, we know that conspiracy theories and incitement against government and incitement against media has played a huge role also in radicalization in the Middle East and elsewhere. So we're starting to see some of this kind of form in the West, in the United States and in Europe, as I mentioned, and also even in South America. And it's taking different forms. So far, we cannot really call it terrorism, or there's hesitation to give it that name because it doesn't look like the terrorism that we are used to, that we have become familiar with. But with the violence and with it kind of approaching this level of taking this ideological tone, there is that threat and that fear in the future that this could be a challenge. And also, as we see the restrictions are continuing, we see the reactions to that amongst the people. It has become very fertile for certain ideological groups in the West and other places, but in particular in the West, to exploit this fear, this uncertainty, this new context and this new lifestyle that people in the West are simply not used to, and this fear of the unknown, or how long this pandemic, and then this distrust in government, the spread in conspiracy theories. They're using that. They're exploiting this for recruitment. They're taking advantage of those who do want to seek answers but do not find answers. And also this polarization that has happened in communities. It's kind of torn families apart. It's torn societies apart. They're exploiting this to a huge extent. And that makes it so very, very easy for these groups, if not arming people. When we say recruiting, we don't necessarily mean at this point arming, but joining them. And as it further takes an ideological sort of shape, this is where the threat becomes real. This is where the moment that there are arms and there are weapons used and the attacks increase, and we've seen several of them, and there have been victims that have fallen over the years, over the past 2 years. Once that increases, it becomes a kind of social type of extremism that CVE community is not prepared to deal with because it has not dealt with it. Terrorism over the last few decades has been associated highly with religious radicalization. Also, economic situation as well has really impacted that. But we see here now, this is very transborder, it's transnational, it's not associated in particular with any religious thought. It hasn't formed, we can't call it exactly a dogma at this point, even though it might in the future create some kind of cult, but at this point it has not. So on what basis does the CVE community, how does it tackle this, is a huge issue. It's reaching out to these communities instead of isolation. Conversation is very important at this point. Extending and understanding why people are terrified of vaccinations and being able to counter this misinformation, that at this point, this is no longer a fringe. We see hundreds of thousands of people falling to the pandemic or losing their lives strictly because they refuse to get vaccinated. Something is causing this. And this is where it's a time to tackle the root of this problem instead of this immense polarization that we're seeing that has not really benefited anyone. Now, this is in the West. In the Middle East, and when it comes to places like Iraq and Syria, initially there was a fear that the pandemic would really halter the anti-terrorism crackdowns or operations. That did not seem to happen. There was relocation of certain military points. Other than that, because in these countries mostly, there are no strict rules that are really taken seriously. So people were not isolating, they were not wearing masks, and vaccinations, some of them decided not to take them. There was no, but there, and terrorists at the moment, these communities, they're living amongst the people because they're underground. They're not isolated in many places. So a lot of the rules that did not exist also applied to them. So we did not see that massive impact in these areas. Whereas in countries more developed, that were more secure and more stable, it was the restrictions that have caused these problems that can be extremely problematic in the future. I think it's really important for CVE and the counterterrorism community to take all this into consideration and restructure a new way to counter this threat that has the potential into turning into the next biggest terrorist threat for the West.
Thank you so much, Raja, for your insights. It's absolutely fascinating the way you have covered so much in such a short period of time. I especially found your reference to this lack of social cohesion and moving away from the traditional definition of what terrorism entails and this new kind of radicalization to be really useful and important for the CVE community. We definitely need to think more and broadly and holistically in order to develop appropriate policies that would be tailored, that would keep in mind the needs of the community and not exclude anyone, which is again one of the key points that you mentioned. It's just so important. And I'm sure there will be lots of questions for you. And with that said, I'm going to move on and kindly ask Samina for her inputs. Samina, over to you, please.
Thank you so much. It's such a pleasure to actually participate in a panel of folks with great expertise. But I'm just going to go all the way down from the abstract to the tangible and discuss the impact of the pandemic on terrorism, counterterrorism, CVE, on two countries that I follow very closely, Pakistan and Afghanistan. I think ASG said it quite correctly, that where you actually have a situation on the ground where there is no stability, where there are major terrorist trends, there's a continuation. But I would still say this, what the pandemic has done, and we're really going back to the same old actors in this part of the world, which is religious extremists and terror groups exploiting social disorder, alienation, and the state's inability to deliver services. The narrative that we've heard in Pakistan, for example, when initially restrictions were imposed on movements and in particular prayers, mass congregations, Islamist groups, and these were not necessarily terrorist groups, but definitely promoting an extremist agenda, depicted those restrictions as the state's intention to clamp down on Islam. And so there were attacks on law enforcement agencies trying to impose social restrictions, on social distancing in mosques, for example. And quite obviously that played into conspiracy theories as well, on a larger level, that this was not really a disease. There were two narratives that we heard on the ground. One was that this is God's anger and a punishment for Muslims who are not observant, and so go to the mosque. And that was a way of actually radicalizing as well, going way beyond religion. And the second was, this is a conspiracy by the West. The vaccine is supposed to make Muslim men and women infertile so that they can't have children. And so these two things fed into this attempt made to reduce trust in the state and the state's ability to deliver. But at the same time, and I think you would have seen this in the Middle East as well, it was the economic impact of the pandemic that's had a major effect. Social restrictions on women, and absolutely we saw those trends. Violence increased. Women who had economic and social mobility lost it, and will find it, if you're talking about medium and long term, will find it very difficult to regain the ground, that lost ground. But beyond that, when we've spoken to ex-recruits, folks who've given up the gun, members of jihadist groups, they've said to us, look, what do we do? It's a job. It's a way of feeding my family. So the jihad then goes beyond ideology. It is pure economics at play. And that is where I think, in Pakistan in particular, the economic impact of the pandemic, the slowing down of the economy, it's a very young population, the increase in poverty, in joblessness, that is a major coup for terrorist groups, for recruitment and for radicalization. So in a way, these two things are coming together. This conspiracy theory that this is actually either punishment because you're bad Muslims, or the state is punishing you. Those two conspiracy theories are coming together. In Afghanistan, on the other hand, there is no state presence. If the humanitarian crisis was there even before the Taliban took over, the economy was collapsing even then. COVID had a major impact on the economy in Afghanistan. Now, with the sanctions and with an inexperienced group that has not really transformed from a militant group into a group that's capable of governance, there are no health systems that are working. We don't know what the extent is, in fact, because there's no data on the spread of COVID-19 in Afghanistan. Absolutely no clue. But what we do know is that there is no state as such that's capable of providing the resources that a desperate population needs. Internal displacement has increased, joblessness, poverty, and as we know from all the reports published by the UN and UN agencies, the humanitarian crisis there is now a calamity. So what are we going to see with the traditional groups that we talked about? The local franchise of the Islamic State, it will definitely benefit from the lack of state institutions that are capable of governing, And also, I would say that you will probably see new groups emerging. Al-Qaeda was there. Al-Qaeda doesn't have those resources that it had in the past. But you have these two parallel ideologies at play, in fact, the two great rivals, ISK and Al-Qaeda, one linked to the new rulers, Al-Qaeda's relationship with the Taliban, and the other that is exploiting the absence of the state and the state's ability to deliver. If we're going to look at where in both these countries, what are the likely challenges? I'd say that, look, it's as simple as that. Can the state deliver, and will it win back the trust of the population in the Pakistani context? And in the Afghan context, even more so, will we see state structures emerge in the future that are capable of delivering basic services, basic protections? At this point in time, there are very few signs that change is on the way in Afghanistan, and very few signs in Pakistan that there is a cohesive counterterrorism strategy. Counterterrorism in the Pakistani context is militarized. So in fact, it actually feeds into terrorist recruitment and radicalization. Counterterrorism in the Afghanistan context is the Taliban targeting the local franchise of the Islamic State, but aligned with Al-Qaeda. So how are we going to see both these trends evolve? I would say that the challenges are grave. In how the international community is going to deal with them in Afghanistan, that will determine the ability to prevent terrorist groups from exploiting the spaces that have been created. And in the Pakistani context, frankly speaking, it's the state agencies and institutions and their ability to understand that their strategies, their CT, CVE strategies are actually feeding into radicalization and helping terror groups expand their space. Thank you.
Thank you so much, Samina. Just wonderful insights from the field, which we are so appreciative about. Of course, Afghanistan is a seismic event, and it would determine our counterterrorism responses and challenges, and how different terrorist groups react to it, and the increase in the morale of terrorist groups, of course, for years to come. You mentioned the economic impact in Pakistan already pre-pandemic, worsened by the pandemic, which is something we have even seen in our paper in multiple areas and regions of the world, where increased joblessness, unemployment factors have increased grievances that are ripe to be exploited by various terrorist groups. Of course, whether or not the state can deliver is a key question. I also found several similarities between what Rasha mentioned about this lack of social cohesion. You started off by mentioning how terrorist groups exploited the COVID-related restrictions by saying, especially in Islamic context in Pakistan and Afghanistan, that it only impacts people who are bad Muslims. We saw this even co-opted by ISIS in instances and other terrorist groups when they disseminated their propaganda, especially online, as a significant part of the global population started spending more and more time clustered away from religious services, community kind of interventions and programs that acted oftentimes as a shield against these kinds of messages. Of course, for those of you who are not familiar with Samina, she oversees the work of International Crisis Group in Pakistan, Afghanistan, Bangladesh, India, and Nepal. She examines the political, social, economic, and military factors that increase the risks of extremism, internal conflict, and war. And she also makes policy recommendations to overcome these threats. I'm sure there would be lots of questions for you as well. But I would move on to our third speaker for today, Mr. Amarnath Amarasingam. So Mr. Amarnath Amarasingam is an assistant professor. He's based in the School of Religion and is cross-appointed to the Department of Political Studies at Queen's University in Ontario, Canada. He's also a senior fellow with the International Center for the Study of Radicalization. His research interests are in terrorism, radicalization and extremism, online communities, diaspora politics, post-war reconstruction, and the sociology of religion. Over to you, Professor Amarasingam.
Thanks very much. Thanks to you and CTED for organizing and the invite. Not sure what else I can add to what's already been said, but I think in terms of the question of how has this impacted my area of focus, I think that it's twofold. I think on the first part, I've been very closely involved with what's going on in northeastern Syria with ISIS detainees, and what happened with the rise of the pandemic in March 2020 was that it gave a lot of these Western governments yet another excuse to not do anything, right? And so we saw, since the arrival of a lot of these detainees in these camps and prisons in March 2019, that there was concerted excuses given for why nothing can be done and nothing can be done to repatriate these individuals. As of October 2020, there are 64,000 people still in these camps, and about 53% are still are under the age of 12. And with countries like Canada and the UK, they were basically given a kind of logistical excuse to add on top of all the other excuses that they were using to not go in and get, bring back our citizens. So that's kind of one of the reasons I wanted to mention, but I want to focus a little bit on some of the broader factors that I think cut across what Russia and others have been saying, which is this kind of collapse in normalcy that happened because of the pandemic, which basically threw a lot of people for a loop, right? We've seen kind of increased collapse in social trust. Institutions of modernity like science, medicine, journalism, academia were always kind of playing catch up to the risks of late modernity. And I think we saw that very clearly with the pandemic, risks that cannot be identified easily, risks that tend to be universal and transnational, aren't really limited by borders, and risks that are largely irreversible once they're out into the ecosystem are kind of the norm now, and institutions of modernity are naturally kind of weak in responding and are always playing catch up with these kinds of risks. What that does is it kind of has increased impact on people's anxiety levels, on impact on their levels of social trust towards these institutions, and that's kind of translated in some interesting ways in terms of challenges that will probably be with us for some time. For one, it's kind of caused people to revert back very strongly to an allegiance to the in-group, right? So we know that immigrants and refugees tend to be coded as security threats or health threats on any given day. But what happens in particular moments of social crisis like the pandemic is that with kind of increased allegiance to the in-group and protectionist tendencies, we saw a lot of anti-Asian attacks. We saw a lot of anti-Semitic attacks. We saw hate in general go up because of some of these things. We saw political parties obviously stoking anti-immigrant fears and using COVID to do it. And I think even overall, it kind of tilled the soil for when anti-immigrant sentiment was eventually going to be useful politically, right? So we had a lot more people kind of primed to hear anti-immigrant messages because of the anxieties that the pandemic produced. One of the ways it's manifested in places like India and Sri Lanka, for example, is majoritarian disinformation, misinformation, and hate speech against minority populations, right? And so one of them, we all know kind of the Corona jihad scare that circulated around India, that Muslim communities in India were purposefully spreading COVID to unsuspecting populations. And so in a way, COVID provided a kind of another boost to long-running animosities and majoritarian anxieties in some of these countries. Closer to home, we saw rises in anti-Asian violence as well, of course. Second, I think, is that the kind of collapse of trust in modern institutions also provided a little bit of a boost to a lot of these accelerationist movements that we're seeing in the West, who have basically been arguing the same thing for a long time, that modernity has failed, that reverting to traditional pre-modern ways of life is the answer, that you might need to hasten all of this along through violence and increased social polarization. So COVID was in a way kind of given to them on a silver platter as the evidence that they were looking for, is like, look what's happening. We were telling you this all along, that modernity has failed, and that now you're seeing it. Now you're seeing it right before your eyes. Finally, I think COVID also gave us a kind of front row seat to how the worst among us are going to react to major transnational crises, right? And the verdict is that they didn't react well. So I think studying extremist reactions to COVID gives us a bit of an insight into how the reactions to similar future events is likely going to look like, right? Future crises around climate change, more pandemics, economic collapse, etc. We got a little window into when these transnational crises happen, how these extremist groups and individuals are likely going to react to this kind of large-scale crisis. And I think that looking at that reaction is going to be quite important. As me and Marc-Andre Argentino have written, COVID conspiracies really served as a kind of bug light or a meeting place for a lot of different ideologies and conspiracies. Everyone for the first time was kind of speaking the same language. So you had Proud Boys and QAnon and hardcore white supremacists all in the same chat room together for the first time in many ways, right? And so in a way, the COVID conspiracy kind of united and brought everybody to the same space to argue against a common enemy. And so that's an interesting kind of side effect to some of what we were seeing as well. So this is all kind of important takeaways for future risk assessment. Kind of global crisis could really bring a lot of people who are usually ideologically disparate together in worrying ways. So I'll leave it there, but happy to take your questions. Thanks.
Thank you so much, Professor Amarasingam. That is, again, fascinating insights on the broader issues that we are facing today, especially relevant the anti-terrorism responses and the majoritarian kind of notions around misinformation and disinformation. Oftentimes, the messages that got out from either state-related medias or sometimes even from the state itself in guise of containing the pandemic. Of course, your final point of how it has brought together very multiple extremist groups across the ideological spectrum is something that is extremely worrying. Of course, the trend has always been very transnational. The challenge has been transnational, but this creates, of course, if not a totally new challenge, but forces all of us to think in novel ways as to how to react to this and how to develop policies. I'm sure there will be so many questions based on the very rich narrative that you provided. But in the interest of time, I think we are running a little behind. I would move on to our fourth and final speaker for the day, Ms. Zenaida Machado. Ms. Machado is a senior researcher in the Africa Division of Human Rights Watch, covering Angola and Mozambique. She has conducted research and documented human rights abuses in both these countries. She covers a wide range of issues, including conflict-related rights violations, terrorism and counter-terrorism operations, as well as access to justice and civil and political rights. I would now give the floor to Ms. Machado, please.
Thank you so much, Anna Schuber, and thank you to all participants. I'm sorry I wasn't able to join you guys earlier due to some technology issues. but I'm here, and hopefully the internet will not trick me again. It's very difficult to discuss the impact of COVID on counterterrorism operations in Mozambique in particular, because when we discuss counterterrorism and terrorism issues in Mozambique, we have to remember that we are talking about two different worlds. The issue of terrorism in Mozambique is very localized to one place in the country, which is the northern part, and it's very far from the rest of the country. It's actually closer to Tanzania than to the capital, Maputo. And quite often what is going on there is not known in the rest of the country. And that's probably one of the reasons why for many, many months, the conflict there took time to get attention of the international community, because it wouldn't even grab the attention of the rest of Mozambicans in their other areas. And COVID is unfortunately in countries like Mozambique, like many other African countries, and Asia. I was listening from the other panelists discussing the similar issues in Asia. It's not really a problem of those that are involved in a cycle, a vicious cycle of poverty, because unfortunately they have other priorities, and for them the priority is to earn their daily money to buy bread and put some food on the table for their children. So for that large majority, the impact has been mostly economic, and with loss of jobs, with restrictions on gatherings. We know for sure that in some of our urban cities, people do their business in places where there are large crowds. The informal sector, which is in the cases of Mozambique, is mostly dominated by women. So women were again the most impacted by the COVID restrictions, either by having to limit their business, also the issue of curfew times that limit their ability to be on the streets and sell their products. But there was also a huge implication on human rights abuse from the side of security forces, and now they try to implement the COVID restrictions, and in some cases using excessive force to stop women and other people from going to the streets or from being on the streets to do their business. At the level of Cabo Delgado in particularly, there hasn't been, where the counterterrorism operations are focused, there hasn't been a visible impact of COVID. Like I explained when I started, people are more concerned about other things, how to keep themselves alive. Malaria is unfortunately a problem that poses more risk to displaced people than COVID itself. Where we have noticed some impact of COVID in the areas of counterterrorism operations is on the humanitarian help side, because unfortunately the restrictions on flights to Mozambique has led many humanitarian helpers to stay away from the country. They were not able to come in and go out. Also because when the COVID-19 problem started, the government introduced some visa restrictions, and the humanitarian visas was one of the affected, and it's still one of the main issues at the moment, with many of the humanitarian organizations complaining that they are struggling to get the humanitarian visa and come to Mozambique to help those in need in Cabo Delgado. Of course, I kind of agree also with the previous panelists that the COVID has also been used as an excuse by the donor countries to maybe reduce the humanitarian aid that comes to areas like Cabo Delgado, but also I wouldn't say maybe excuse, but maybe what happened to many of them is an issue of priority, that they chose to focus more on COVID, for example, rather than big displacement crisis like the ones we have seen in Ethiopia or in Mozambique or in Syria or in many other parts of the world. So it appears that at this stage, all eyes, all funds, all brains are focused on COVID-19 vaccines, where to send the vaccines to. And I was the other day discussing with a scholar about how often we see in the news donations of vaccines against COVID, rather than, for example, humanitarian aid for people in Cabo Delgado, 800,000 people who have been displaced by the terrorism and counter-terrorism operations in the province. So on the benefit of time, I think I can stop here, and then we'll continue to engage as the questions come in.
Thank you so much, Zenaida. That was really insightful. And of course, you raised really crucial points about the humanitarian aspect and how the aid has, of course, been impacted. We also see greater impacts on fundings of civil society organizations, of broadly in counterterrorism capacities, and training and assistance, oftentimes in fragile societies requiring such assistance. I'm sure there would be a lot of questions for you. I would start the discussion, but I wanted to remind our participants, our audience, that we would be having a Q&A session shortly with the panelists. So if you have any specific questions, please feel free to have a think prior to that. Yeah, we would be having that shortly. So I would start by asking all of you a very broad, future-looking, forward-thinking kind of question. Of course, all of your insights were remarkable given the breadth of what you covered, and it also portrayed how complex this challenge is that we are facing. For us, within the United Nations and also within CTED, we have always focused on thinking about this challenge and focused on collaboration with our partners. And I think that the pandemic has really highlighted the need for multilateral cooperation across policy matters, especially on counterterrorism. But as some of you mentioned, that there has been an increase in nativism and xenophobia, marginalization of certain communities that moves away from this instincts of collaboration and the requirements of collaboration that is imperative to address a global pandemic. Zenaida's last intervention focused on the requirements of humanitarian aid, but we see that some states have justifiably, understandably taken away, diverted counterterrorism resources and funds to other sectors. Amar Singham mentioned the repatriation issue and how the West has almost used COVID as an excuse to essentially not do much on this at all. The increased militarization of counterterrorism was mentioned, and how terrorists might use this as almost as a ploy to radicalize to violence more vulnerable communities. So given the focus on collaboration that we see that is required for the pandemic, how do you think the counterterrorism community would take these realities and lessons from the pandemic that would impact future counterterrorism responses and collaboration between member states, collaboration across different non-state actors? What would the lessons that we learned in the past 21 months, how would that get translated? What would it look like? If anyone wants to jump in, I would urge anyone who wants to jump in to start. All right, Rasha.
I'll start with just continuing on what I was talking about, mostly about the threat or the incoming threat that is in the West. In that we see that there are, of course, when we think about the impacts of a global pandemic on CVE and CT, we think global scale because That's how the operations and that's how the collaboration has been over the past 2 decades. But what the pandemic has taught us also is that it's also extremely micro level, meaning it's at the level of community, at the level of county and neighborhood. This kind of collaboration is new. This is not something common. So it's not only member states, it's how each state kind of breaks down this collaboration, that it can be at the state, city, county, and neighborhood level. The outreach into smaller communities and societies here is very important. And this is less counterterrorism, it's more counter-violence, violent extremism. It's prevention. What we're trying to do, and Ammar, I believe, briefed this very well, we're trying to also prevent this new trend from actually turning into terrorism and reaching a point that it becomes too hard to stop. Because once these ideas are in society, and we see them now, they've become mainstream, they've actually cornered the rest of society to sit with them on a table and actually discuss, where we have to discuss and we have to explain why vaccines are important. 5 or 6 years ago, that probably was not a possibility. No one really thought that this would happen, but now we're at that point where we have to. So cooperation at a smaller level, and this applies to the United States, it applies to Europe, even in the Middle East. I believe also a lot of what Samina talked about the conspiracy theories and how this is against a certain religion or against a certain group, that also applies very well to the Middle East. What has happened there, I believe, and this is just my personal theory, is that in areas that are war-torn and the conflict there is continuous, the impacts of the pandemic itself kind of just fell under the rug. It fell under the other conflicts that these communities face. So it was not as devastating, whereas areas that are secure and safe, this was a completely new challenge for them. And as Ammar said, these communities faced it very differently. The reactions to it have been more extreme. So the cooperation at this level requires a lot of rethinking. How can states rethink the outreach to communities? We saw this in CVE in the Middle East with the idea of countering violent thought before it turns actually into extremism, what is considered tolerant and intolerant, what we can accept as free speech versus incitements against others. How can we translate that or make use of that experience into communities in the West, where there isn't a particular threat against a group verbally, but it translates into that, as you mentioned, the marginalization, the anti-Asian hate, the anti-Semitic hate, which has now become, I would not say mainstream, but it is not necessarily, it's not being countered as it would be 5 or 10 years ago, when hate speech was countered, when was confronted, it was called hate speech. Now some people are saying, no, we are just discussing, we are just asking questions. And that's a very slippery slope once we get into that, where any kind of hate speech or incitement is tolerated and is actually considered as discussion or challenging the public narrative or the official narrative. That is very, very dangerous. So CVE, and in order to prevent this from going into that phase where it becomes armed and it becomes violent and people lose their lives, CVE needs to do some rethinking and outreach directly into smaller communities. So far, when it comes to this, we've seen this in previously when CVE, there were approaches to organizations like CARE and to local mosques when the threat was coming from Islamist extremists. But now it's coming from a transnational thought, whether it tends to be more on the far right or whether it tends to be on the far left. We're not really seeing anyone or any idea how to reach out to these communities that are by far more Western. They tend not to be affiliated necessarily with a certain religion. They don't look like our perception of terrorists. There has been no outreach to this so far. And I don't see, at least from my observation, that anyone has thought of an idea of how to rethink CVE so we can approach these communities. Thank you.
Yeah, I can jump in quickly.
Yes, please do.
Sorry, yeah.
No,
I mean, two things. I think one, as Rasha was saying, COVID really kind of sucked the oxygen out of the room in terms of any policy discussion other than how to counter the pandemic, right? And rightfully so for a time. But I think there was this problem of a lot of youth activities, a lot of programming, a lot of policy decisions were basically shelved until this runaway train was kind of brought under control. And so a lot of those problems remain and have often been exacerbated over the last 2 years. And so we need to kind of refocus some of our energies on that front. Second, I think, as Rasha was saying, the kind of evolution of the extremist landscape is something that's catching people off guard, right? If you look at the prevent data that the government puts out every year, the category of unknown is actually on the rise, right? So it's this kind of poly-ideological, post-ideological, bizarre mix and match of different ideas that now frontline workers or social workers are finding, and they don't really know what it is, how to deal with it, and how to respond. And I think so. Understanding how this extremism landscape is evolving and putting that knowledge into the hands of frontline workers is going to be very important. People like Mustafa Ayad at ISD have shown very bizarre interactions between Salafi groups taking on alt-right aesthetics. You have a lot of far right who are celebrating the takeover of Afghanistan by the Taliban, and so groups that you would think would just kind of remain in their own little corners and own little bubbles are actually interacting more and sharing ideas and sharing aesthetics a lot more. And so I think that understanding needs to trickle down a little bit into more frontline workers, I think. Second, and one more thing is I think our entire CVE apparatus is very much formed and formulated around young men, right? And so I think that in itself is changing over time. As again, if you look at the prevent data, the number of far right referrals to channel is actually, I think, quite a few of them are 50 plus. Right, and so you're talking about middle-aged white men on the far right side, and our CVE regime isn't really built for that. We don't know what to do with changing demographics in terms of how extremism looks like these days. And so I think a lot of the programming has been built around young men, and that also is evolving quite rapidly, and we need to keep up a bit more.
Thank you so much. That's, again, just wonderful and fascinating. I thought that the highlight on the micro level issues is just so important, because oftentimes when we have these events and we are thinking broadly about issues, we forget that the intricacies happen at the community level. Professor Amarasingam mentioned the frontline workers, the social workers, people who are dealing with this day to day, who are actually dealing with somebody coming in for the first time. That's just so essential for them to know what is going on, and for us to connect those dots and try and understand the complexity of the situation. You did mention one thing that struck me to be really interesting on CVE being formulated against young men and not having the terminology or the language to deal with the other demographics that are now coming in. I would like also to point out the issue of gender, because oftentimes when we talk about these things, we kind of tend to see women in binaries, and you did mention Al-Hol again when it comes to repatriation. It is very essential to not think of the women who are affiliated somehow with ISIS either as victims or as perpetrators without the lack of any nuance or gray areas within. So I would like to pose this question to the panelists, also looking forward to hearing from Samina and Sunita about their field level expertise on this area. There has been an increase in misinformation and disinformation, of course, and online hate speech, and a lot of them have been targeted towards women. So how do you see this kind of situation being co-opted by the extremist elements, where you find women spending more on time online, and not that there is any correlation with that and potential radicalization, but there is this disaffected community, and we of course still lack targeted gender-based programming that are there in the CVE space. So how do you think of this long term, where you on one hand find COVID worsening gender inequality, and on the other hand you have extremist groups looking to radicalize, recruit more and more people, including women, into their groups? So Samina or Zanita, if you have witnessed anything like this in the field, or yes, Samina.
I think that's a very good question, and that's something that we've been following, is how women are being approached mainly online. Now, clearly, given the fact that you have to have access to internet services in the first place. Now, in both, in fact, many of the countries that I cover, that has changed as well because, for example, in Afghanistan, that country was destroyed completely by civil war. So it actually skipped a generation. Landlines were not restored. You went straight to cell phones. So access to the internet and the ability then to reach out changed drastically. Preachers, in particular, women preachers, are reaching out to other women for radicalization. And we've actually seen that done in a fairly organized way. How effective they are, I think that depends very much, again, on the social mobility of the women that they're targeting. University students in particular are vulnerable. And we've seen actually cases, not that many, but cases of young women, students in particular, being specifically targeted and joining these groups online, and then going a bit further from just discussions to actually trying to be more proactive in the work that they're doing with these groups. But I want to go back to, I think, a very important point that was raised early on, which was reaching out to communities. One of the things we tend to forget is that as we're speaking, one of the most vulnerable, actually, groups is health workers, because they're on the receiving end of these conspiracy theories. We've seen attacks on hospitals, we've seen attacks on doctors. We've heard, mobs chanting that they're trying to poison. COVID doesn't exist, there's no such thing. This is just a way of the medical profession to make money. So they actually are infecting people with this disease. Frontline workers also are rights activists. And if you're talking about links, civil society organizations have suffered the most in some ways because of the lack of funding, for one thing. It's reduced considerably, but also the lack of protections. And because we've all been talking about narratives, their narrative is different. And in fact, it's effective. So they then become the threat. Protections to rights defenders. I did a panel discussion just a few weeks ago on the impact of Talibanization on Afghan and Pakistani women. And we had 4 remarkable Afghan women speakers. And I must say that those voices reaching out beyond just to other women, it was a voice of moderation, support to these communities. These are communities as well. I think is something that we have neglected in some ways, both to communities in the health sector who are on the receiving end of these. And you talked about the West, it's not that different there as well. Vaccination, it's poison, they're poisoning our children. It's the same elsewhere. These are vulnerable communities within communities, which I really do think that reaching out to them now would pay many dividends, both in terms of CVE, but also in terms of de-radicalization. Thank you.
Thank you, Samina. I do not see Zenaida's hand up, so I am going to move on to most likely what's going to be the final question from my side before we move on to the question and answer segment. Once again, fascinating discussion. I would like to ask all of you about something that you touched upon in one way or the other, that is the impact of the pandemic on economic downturns and what it means for all the people at the community level, and also the interactions between unemployment, potential for radicalization, and CVE programs. So taking that issue a little further, I was wondering, on one hand, we have severe economic downturns from the pandemic that is exacerbating social inequalities. In this context, do you think that climate-related vulnerabilities, especially in societies that are already facing the threat from terrorism, might in order to increase grievances and open up the possibility for further radicalization to violence? And do you foresee extremist groups exploiting the fallouts from the climate crisis in the near future? So over to you. We do not have anyone for now. We have Samina. So over to Samina.
Just very briefly, one of the things we've seen is droughts and floods. Again, where you've had major natural disasters because of climate change, it's a huge opportunity for terrorist groups, for extremist groups to exploit the state's inability or unwillingness or disinterest in responding. In Afghanistan right now, one of the major challenges is drought. And quite obviously, you know, this ties in with your earlier issue of economic hardships. If the state doesn't provide or isn't capable of providing, the handouts will come from somewhere else. And those handouts would be welcome. We've seen this where there have been major earthquakes in particular. The first groups out there are the terrorist groups. They're incredibly well organized to deal with natural disasters. It's actually very impressive how well they are at exploiting the ravages of climate change. Thank you.
Thank you, Samina. Over to Rasha, please.
Thank you. Also, very briefly, I'm going to talk about the context now in Iraq and Syria in particular, where while it's not exactly a drought at this moment, but the decreasing levels of the rivers in that area due to natural reasons, natural causes, and also because of the continuous building of dams from Turkey and in particular from Turkey has caused also this issue. It's become sort of a climate issue because the livelihoods of hundreds of thousands of people within the desert area between Iraq and Syria does rely on this. We're talking sheep herders and elsewhere and others, and they are seeing their cattle die, and also people who, farmers who rely on crops, they're also seeing their produce completely go to waste or die out very early. This is a huge problem, and it's increasing with the government, whether in Syria and Iraq, with very little resources to counter this. And what we have on the Syria side, in between the borders between Iraq and Syria, that is where ISIS sleeper cells are still active. And this is a very fertile place for them to recruit. If we go back to the beginnings of Al-Qaeda back in 2003 in Iraq and Syria, in Iraq in particular, this is how they started. They would exploit any economic issue, any social issue, and manage to recruit people. The situation now is more dire. And in this area, despite the fact that the number of ISIS cells or even Al-Qaeda are less than they were in 2003, and they are restricted in their capabilities and their resources. This is a place where they can recruit from, and they do enjoy recruiting from natives, from locals, because they know the terrain, they know the language, they can serve them very well. This is in the area between Iraq and Syria. If we stay in Iraq and go to the south, we see another phenomenon. There's a government-backed umbrella of militias called the Popular Mobilization Forces. Now, this has become, to a huge number of young people, young men in particular, the only source of income. They join these militias, and they can guarantee their livelihood. They guarantee at least a monthly salary, at least almost every other month. And in a country where unemployment is a huge issue, this becomes an option. And it's getting worse now because also the drought and the drying of the rivers is beginning to impact what was once a very fertile area in the south. There's actually an ongoing research between two villages near Basra, one of Basra in South Iraq. One of them, the water resources are still plenty. And in the other, there's a drought there. There are no water resources. And both villages have historically relied on fishing as a huge source of income. What we see is that the village that continues to provide job opportunities because the water is plentiful there, the number of people that have individuals that have joined the militias are very few, versus the village that is not too far away but does not have enough water resources. Thousands of young men have no other option but to join these groups. And at these groups, at some point, even though they are nominally under government control, many of them also act as non-state actors. They're extremely violent. They've been accused of human rights violations. They have abducted and killed activists and civilians. So they're also considered, at least by the international order, to be terrorist groups. So here we see in these two countries, in Iraq in particular, it's a growing concern. And it's very also very black and white. So some days there's a complete drought. The other day there are floods. And in both of them have a negative impact, not only on the environment, but also on the people who rely on this water for their livelihoods. We've seen very little action from governments towards this. Again, as a previous panelist has said, with the focus on COVID, strictly on how to protect ourselves from COVID or how to combat the pandemic, there's been less focus on these environmental issues. But this is also another source of concern. And along with COVID, they seem to be playing into the hands of these extremist groups. Thank you.
Thank you so much, Rasha. That was very insightful, and of course points to the existing concern that as with economic downturns and lack of resources that might push people towards these kinds of extremist groups. We are past the time now for the discussion, so I am going to move into the Q&A section, and we have a couple of questions from our audience members. The first question is not directed towards any of the panelists, so feel free to jump in. The question is from Jamie Brown, and he asks, he suggests that there is a tendency to think about COVID-related conspiracy narratives within existing frameworks of pre-existing ideological structures, either right-wing extremism or left-wing extremism. That's the terminology he uses. So he wants to know how is this COVID-related trend that we currently see, whether or not it's unique, and if it is, how would this convergence change the counterterrorism and countering violent extremism approach? A lot of panelists have already had really insightful points on this, but if anyone wants to highlight and focus on the convergence and the transnational issue of the threat, please go for it.
Yeah, I can start. I think it's still a bit early, and the data or evidence isn't really in to know very clearly whether this is kind of a COVID-related blip that we're seeing in this kind of convergence of different aesthetics and different ways of thinking, or whether it's a kind of new threat that's going to be with us for some time. That's kind of the nature of the landscape these days, is that things evolve so quickly and things come and go so quickly that you don't know if it's just a kind of, you know, flavor of the week or something that we need to actually be concerned about long term. I think generally, though, this kind of eclecticism the very act of being eclectic is a long-term trend that we'll have to come to terms with. And like I said before, I think a lot of our frontline workers, CVE workers, are very much trained along ideological, on the assumption that people are in ideological silos and they're going to remain there, that certain demographics are more prone to this kind of thinking than others. But that is very much starting to change, right? And so, but from what I have a lot of friends who work in CVE, and for them, the ideology in terms of their everyday work is actually less important, right? So they don't necessarily broach ideology first with a young person or whoever that they're trying to help, because they know it's quite important, and therefore it's not really the first thing you want to build a relationship on by talking about ideology. And so they generally leave it to the end and focus on other issues like family, employment, mental health, and so on. And so I think on a day-to-day basis, it may not have much of an impact in terms of how frontline workers are going about their work, but they are increasingly realizing that they don't know some of the trends that are happening. They don't know some of the words that these young people are using in their offices and the gaming spaces that they're in. They've never heard of these platforms. And so there's a kind of call, and I've been involved with a few of these, to kind of bring the knowledge up to date, so to speak, right? So just so they know what they're dealing with. And so I think we'll be dealing with that a bit more going forward.
Thank you. Before I move on to the next question, I actually had a follow-up. You mentioned gaming, and I was just wondering if you could talk a little bit broadly on the terrorist exploitation of various ICT platforms, including gamings, and what would be certain concerns that we need to keep in mind moving forward, because it is becoming a key issue that several member states have expressed concern about.
Sure. Yeah. I mean, I'm involved with the project on gaming as well at the moment, and I think what we're seeing is, in-game chats. Certain platforms like Discord are much more prone to this kind of extremist content. But in a way, gaming spaces are having the same impact as any other social media spaces that we've dealt with in the past, right? It's about building friendships, building brotherhood, sisterhood, building community, finding a way to come together with like-minded individuals. And so the gaming aspect has a unique element in that it's kind of simulating real-world activity. But at a fundamental level, it's giving people the same social and psychological benefits as any other platform that we've dealt with in the past, whether it's Twitter, Facebook, Instagram, etc. And so there is a unique element to gaming in that we've seen a lot of extremist groups kind of exploit gaming, create their own games. For example, the famous one being kind of the Christchurch the far right redoing of a game to make it seem like you are a first-person shooter in the Christchurch video, stuff like that, which is has been quite worrying. But at the end of the day, I think it's providing the same kind of benefits that anything else is, any other one of these platforms are.
Thank you. That was, once again, really insightful, and I'm sure a lot of people would be interested to follow up on that. The next question is from CTED's Farah Qasim, again to all panelists. She wants the panelists, if possible, to speak more specifically to the impacts of the pandemic on children and youth in the CT and CVE area, including in relation to their detention in prisons, as well as the camps in northeastern Iraq and Syria, and what could that mean for future work on counterterrorism and countering violent extremism?
I guess I could start again. I think, so I mean, having visited the camps a few times now, I think there's several things that the children there, and again, it's about 53% children of 64,000 people. So one of the first things you see when you walk into Al Hol camp, for example, is that it's just a sea of kids, right? It's just kids everywhere. And some of the things that they're struggling with, obviously, interrupted education, is a major one. A lot of these kids were kept out of school because of violent situations, and so they've many of these kids have been out of school for 3 to 5, sometimes longer, 3 to 5 years, sometimes longer. And so when they return home, that's going to be an ongoing problem. Many have experienced death of a parent, death of a sibling, parental separation, obviously early exposure to violence. They've witnessed executions, shellings, drone strikes, beheadings, etc., at a very young age. And now, after all of that, I think they're also experiencing quite a bit of refugee experience, right? And so food security issues, anxiety, depression, survivor's guilt. They've been moved around a lot from Iraq to Syria, sometimes within camps and sometimes from the camps back to their home countries. So there's a kind of loss of culture, dislocation, learning new languages. All of these kind of problems persist with these young people going forward, and so they need extended early childhood trauma counseling, right? And so I tend to fundamentally disagree with seeing what's happening there with the children through the lens of radicalization. I don't think that's the adequate lens. I think it's much more about a lot of these kids have experienced early childhood neglect, and they need to be treated from a social work perspective, not from a CVE perspective. And so I think that's been my emphasis so far with particularly with the northeastern Syria situation.
Thank you. Unless we have anyone else jumping in, I would like to move on to the following question. So Ms. Valerie has a question once again for all the guests and panelists. She wants to know if there were any cases of real use of people with COVID infections to infect minorities, as it was a year ago in the US when there were attempts to infect members of the Jewish community and the police with the infection. I would like to add on a question to that. I would like the panelists to kind of think about instances if you have come across counterterrorism laws being used by states to address issues like this and to contain the pandemic.
I mean, in Western countries, I know in 2010, I think early on, there were calls by some far-right groups to purposefully infect Jewish communities and Muslim communities, et cetera, as a way to kind of foster polarization and so on. But I don't remember any evidence of that actually happening. I mean, they call for all kinds of things, but I don't remember any of that actually happening. There was also a lot of misinformation that went around in places like India, Sri Lanka, I think maybe even Myanmar, where there was a lot the kind of corona jihad fear, of course, is that a lot of Hindu nationalists were pushing this misinformation that Muslims in the country were purposefully infecting the members of the Hindu majority to kind of rejigger the demographics of the country to make themselves the majority, etc. We've written on that quite a bit. I can put the link in the chat. But I think there were kind of misinformation, disinformation, and fears around this issue. But I don't remember any evidence of anything actually happening.
Thank you so much. I have a specific question for Zenaida. Farah Kazim from CTED wants to know if there are specific impacts taking place in relation to investigations and judicial proceedings on counterterrorism issues at the moment in Mozambique, also focusing on the prison system there. Zenaida, if you're still with us, maybe not, which is absolutely okay. I don't see any other questions in the chat box. So I'm just going to ask one final question from my side. So given everything we have seen in the past 21 months, hard to believe it has been so long, but is there anything positive you see moving forward? I kind of started off with lessons learned and what we can take from this experience. but are there anything specific that you have witnessed that gives you hope for, a better, more holistic and comprehensive response when it comes to dealing with these challenges in the future?
I can point to one silver lining that we've noticed through our research, especially on disinformation and misinformation, is that at the same time, there are people, unfortunately, being radicalized towards conspiracy theories, and this is at a global scale. But at the same time, we see a lot of people that had previously sort of fallen into that camp get out of that camp and now begin to believe science and trust more in community and preach against these kinds of ideas and these kinds of conspiracy theories. And we see this also at a global scale. So it's very marginal and it's very small. And unfortunately, it had to take a pandemic and hundreds of thousands of lives for them to actually kind of, let's say, go over to the other side and see that there is no conspiracy theory. This is a pandemic, and governments, whether states, organizations, are just doing the best that they can. But that does give us hope that that perhaps these conspiracy theories, perhaps these ideologies that are now beginning to form and almost have taken a shape of a cult, where being anti-vax has become an ideology within itself, and that is a fear we have for the future. We do see that de-radicalization is possible, that it has happened. We have evidence of this happening. So that sort of gives us hope that it's not going to be perhaps as hard and complicated as previous attempts of de-radicalization. And because there's no ideological umbrella, because these groups are not far right, they're not necessarily all white supremacists, they're not necessarily all far left accelerationists, because sometimes it is confusion and the lack of answers, the lack of information, the lack of access to information, and perhaps just no one actually to explain it properly. Because we have all of this, it's going to perhaps be easier or more possible to revert these people back and push them away from radicalization. I would say that would be one thing. The other silver lining, and I'm going to jump to the other side of the world, which is in the Middle East, because you talked about climate change and COVID. All of this together has really, because it's exacerbated the situation there is by far more attention now and interest in climate and how to counter climate change and how to be active against it in the Middle East, particularly in Iraq, than there has ever been in the past. And that is a huge change because it's impacting an entire generation that now has really focused so much on climate change. It's quite incredible to see. And these are people who were born after 2003, so they have access to the internet, they have access to technology, very different than previous generations, and they have committed so much of their time. This is what civil society organizations in Iraq are focusing on. This is also a very positive change, and it had to take quite a tragedy for this to be about, but it is happening, and that also gives us a lot of hope.
Thank you so much, Rasha. That was really wonderful to hear. Samina and Amar, if you have some final words on this, I would like to hand it over to you.
Sure. I mean, this is always a hard question because positivity isn't really part of my factory setting. But I think, I agree with Rasha in the sense that a lot of what we assumed was going to happen with a lot of the anti-vax narrative in particular, it hasn't necessarily come about, right? I think there was an assumption early on that the anti-vax community, people who were vaccine hesitant in terms of COVID, was going to be 20, 30% or something like crazy like that, where is in Canada, I think we're down to only about 10% who haven't gotten the vaccine. And so even though there's a lot of fear around it, around people being vaccine hesitant, the vast majority do seem to be taking it and adopting it, and at least with the assumption of hoping to move on with their lives. And so that's one thing. And I think the other thing to keep in mind, I think, is a lot of this happens very interpersonally, right? I think we tend to be overly drawn to kind of programmatic solutions to some of this stuff, whereas the way I've seen anti-vax people come to the other side was because they knew somebody, their sister got vaccinated and vaccinated their children, and then nothing happened to them, and that slowly kind of got the ball rolling. So a lot of this happens interpersonally and organically in many ways, and so we don't need to program everything. I think some of it just from interpersonal trust relationships. You know, people have changed their minds just because their pediatrician who they've known for 20 years has recommended the vaccine, right? And so something very basic like that can change people's minds. It doesn't need to be a large-scale campaign, so to speak. So, yeah.
Thank you very much. Over to Samina, please.
Been a silver lining, I would say, is a greater awareness in the public that the governments have to deliver on health services. And because there's that greater awareness, there's more pressure to improve health services. So both that awareness of the need for medical assistance that goes beyond just COVID. Remember that in the countries that I cover, COVID actually it's a pity our colleague from Mozambique isn't there, but you know, it's everything from malnutrition to malaria to dengue fever to tuberculosis to polio. But just this push now on governments that they need to protect and serve their people, and they demand then for these services, I think is the one thing that you could think of in terms of a silver lining.
Thank you so much, Samina. I see no other questions in the chat box, so that means that we have come to an end of this panel discussion. Before I hand it over to Dave for the final remarks, I would like to thank all of you for your very thoughtful insights. You covered such a huge ground and kind of established how complex the problem is. And also the final round of thinking about the positive side, if there is any, or just a silver lining, is important because we need to be hopeful that we can establish and create better policies, better measures to be able to deal with this huge crisis that we face. It is generation defining, and we have all come together and thought through and kind of collaborated, at least for us in CTED, our paper and the video that you saw is a testament to the strong partnerships that we have, including with the Global Research Network members. So once again, I would like to thank all of you panelists and also the audience member to attend today's event. With that said, I'm going to hand it over to Mr. Dave Wells, who is going to provide the wrap-up comments. Over to you, Dave.
Thanks, Anna Schuber. And yeah, I'd just like to echo everything you said and everything Michelle said at the start in terms of thanking all of you for taking the time to be with us today. I know it's a particularly busy time of year in the holiday season, so it's really appreciative of giving you your time, particularly on a Friday as well. Yeah, I'd also like to thank all of my colleagues and echo Anna Schuber's comments in terms of the collaborative nature of both the paper, the video, the event, and all of the work we've done on COVID over the last 21 months, which, as Anna Schuber said, does feel quite a daunting number, particularly as we start to look ahead and think that number is going to continue to grow, unfortunately. But yeah, just a few reflections from me on some of the things I've heard, and then in addition to the positive or the silver linings we've heard, I'll hope to give you a couple more minutes of your day back, which I think is always good at the end of a meeting. So yeah, firstly, I think I've heard some really interesting insights about new forms of extremism, and I think it's important that we have had that nuance that at the moment a lot of these aren't necessarily violent extremism, it's not necessarily terrorism, and so thinking ahead about how we define different movements, I think is going to be a really big challenge. I think the conspiracy theory issue is something we've covered in our own reports, and I do think it is interesting. I use the kind of analogy of a bug light drawing all these people into the same spaces, and I think we've seen that in those kind of anti-lockdown or conspiracy theory groups where you do bring people together you wouldn't expect to be in the same room or the same forum. So I think thinking ahead about what that means for terrorism and CT is going to be really important. I think I'm glad we touched on the gaming issue as well, but I think particularly this issue of this kind of pick and mix of ideologies, or the unusual combinations that we're seeing. I think it's important, as Amar said, to think about whether that is a long-term trend or whether that's something that is unique to the current moment. But I think with the current moment extending beyond what we all hoped it would, I guess that's, you know, greater potential for this to be something we think about long-term as well. I thought that the point around the kind of diversity question is a really interesting one. I think some of the PCV responses that we've all seen over the last 10, 15 years are very much aimed at young people. When we think a lot about education, think about critical thinking. And I think when you're dealing with a much older demographic who have much more established ways of thinking, ways of behaving, I do think some of those are much harder to challenge. So that's something we need to think about. I think we've heard a lot about governance and state authority across all of the different regions we've heard about. And I think particularly from Samina's perspective, thinking about Afghanistan and the challenges, the huge challenges that state will face in terms of both humanitarian issues right now, but more broadly thinking further ahead, is something that's going to impact in Afghanistan first and foremost, but across the region, I think potentially more globally. So that's certainly going to be a priority for CTED moving forward. I think the discussion on climate was really useful as well. As you may have seen, there was there's been a number of discussions at the Security Council level over the last few weeks about the linking of climate change to security, and an attempted resolution earlier in the week. And I don't think that discussion is going anywhere. So I think having the level of nuance that we've heard today about the different relationships between climate and security, and I think particularly the relationship between climate and the economy, and how economic factors can be a really key driver in so many parts of the world to radicalization and recruitment. It was also great to hear about Al-Hol, and certainly not in a positive sense, but to remind us all that this issue isn't going away, and so many of the factors that have been a problem for the last 2 years are only getting greater. So you know, the urgency of developing a strategy and a response to that, it remains. And I think one of the really interesting things that I took away from this was the question of resilience. It's something we talk about a lot in the CT context, and talk about at the societal level. And I think it has been interesting that certain parts of the world where perhaps we you know, like to tell ourselves are developed and strong democracies and strong societies, perhaps haven't been as resilient to this huge challenge as one might have expected. And I think perhaps in other parts of the world where, as both Samina and Zenaida touched on, COVID is just another challenge that people are facing, and it isn't necessarily the biggest one. It perhaps hasn't had the impacts at a societal level that maybe we've seen in other parts of the world, and particularly in the West. So I think that is going to be a growing challenge, and something we do need to think about when we're thinking about societies and polarization and resilience to extremism and violent extremism, and perhaps thinking about those at a societal level. So yeah, those are just a few thoughts from me. It's been a really fascinating conversation, a really great way for us to wrap up this paper series that CTED has been working on COVID. It certainly doesn't mean that CTED isn't interested in the issue of COVID and the impacts on terrorism and counter-terrorism moving forward. It's something we're going to continue to look at. So insights such as the ones we've heard today from the research community and civil society are really, really valuable. So thanks once again to the panelists. And I think that's it. We can wrap up there. Thanks all for your time, and have a happy holiday and a healthy holiday season. Thank you.